Good morning, everyone. My name is Sarah Anderson, and I am here with USF College of Pharmacy, Class of 2017, Academic Group 3, and we are going to discuss the difference between some common over-the-counter cough and cold medications. So let's face it, being sick is difficult enough. The last place you want to be when you're coughing and your head is pounding is wandering around the pharmacy looking for the cold and flu section. What do you do when you get there? You find rows and rows of options and you get confused. DM, ER, CF, severe cold, mucus relief, PE. Face it, the list goes on and on. It doesn't have to be so complicated, and that's why we're going to give you some advice today to make choosing the right over-the-counter cough and cold medication easier. So keep calm and carry on. It's going to be okay. The first question you need to ask yourself is, what are my symptoms? How am I feeling? Answering these questions will help make the right choice for you. Is my cough wet or is my cough dry? Is it more of a scratchy throat cough that just won't go away? Or is there some underlying mucus that you just can't seem to cough up? Is my nose running? Or is my nose stuffed up? Or is it a little bit of both? Am I sneezing? Do I have a headache? Do I have any body aches? Am I running a fever? Or maybe you just feel like you're getting sick and you want to kind of ward off the sickness. So now that you've thought about your symptoms, let's talk about how to make the right choice for you. If you were just starting to feel like you're coming down with something, there are options for you to possibly help boost your immune system. There are several over-the-counter options that have ingredients such as zinc, echinacea, ginseng, and vitamin C, and these come in various forms like powders that you could dissolve in a drink or some water, or they have throat lozenges as well. The evidence is mixed, however, on how effective these treatments are, but there is some limited evidence that does show that they can help minimize your illness. Now, if you notice that it's too late to prevent the cold from coming on and you've already got a full-blown cold or the flu, next we go to what your symptoms are, like we discussed before. How are you feeling? When you answer all of the questions we discussed, then you can go into discussing and figuring out which over-the-counter medication you will need to ward off your cold symptoms. OTC cough and cold medications are broken down in two basic ways. If you have a dry cough, then you're going to want to select a product with an active ingredient of dextromethorphan. This will help minimize your cough. Most of these products that have dextromethorphan will be labeled with a DM on the front of the product. If you've got a wet cough, you're going to want to choose a product with the active ingredient guaifenesin. This drug acts by thinning out your mucus, therefore making it easier for you to cough up the mucus that's giving you the issue. These products will usually say mucus somewhere in the name. Once you know whether you want a DM or a mucus product, we can deal with some of your other symptoms that you might be experiencing and talk about the other additional ingredients that are in OTC cough and cold medications to help these symptoms. If your nose is running or you are sneezing, you might want to select a product that has an antihistamine. Some common antihistamines include diphenhydramine and chlorpheniramine. These ingredients will help keep your nose from running and reduce sneezing, and they are usually found in various multi-symptom cold flu formulations. If your nose is stuffed up, you're going to want to select a product with a decongestant. Some common decongestants found in OTC products include phenylephrine and pseudoephedrine. These products work by decreasing the swelling in your sinuses, drying them up, and therefore helping out your breathing. Lastly, if you have a headache, body aches, or a sore throat, you're going to want to select a product that has acetaminophen in it. This can help ease some of your pains and can even help reduce a fever if you have one. There are a lot of choices in over-the-counter cough and cold medications when you are not feeling well. The important thing to remember is there is a formula out there for you, but you have to think about your symptoms first and how you're feeling. Your pharmacist is always there to help you choose, and they can even discuss with you some of your medical conditions and medications that you may be taking in order to help you make a safe and effective choice. One last thing. Although these medications can help relieve your symptoms, they will not fight the infection causing your symptoms. For this, you need to make sure to keep your body strong by getting lots of rest, drinking plenty of fluids, and taking care of yourself. I hope that this discussion on differences between common ingredients and over-the-counter cough and cold medications will help make it easier for you next time you are wandering around the pharmacy trying to figure out what to get to make you feel better.